So we're just coming on to the final section, and that was the most complicated section on shielding. So this is an additional measure that was brought in to protect those people who are extremely vulnerable. So we've got those people who are either over 70, under 70 with a long-term condition, or we've got women who are pregnant. Now, these people are people who have received an organ transplant, who have cancer and undergoing active chemotherapy or radiotherapy, or they've got some form of blood cancer such as leukemia, severe respiratory problems, so cystic fibrosis, really severe asthma, severe COPD, and people at risk of rare diseases. If you're on immunosuppressive therapy, so this could be anything that increases the risk of infection. So you may have heard of medication like methotrexate and azathioprine and steroids, where they're dropping the immune system down. These type of people are at high risk if they catch coronavirus of having the severe complications. And then finally, for women who are pregnant, who are known to have a significant heart disease, whether that's something they've acquired or whether it's congenital. And these people would have and should have by now received either a message via their GP or a letter in the post advising them that they are high-risk individuals, and these people need to isolate. So they need to take the household isolation route in terms of isolating themselves within their house for 12 weeks, and that is a significant amount of time. So they need to strictly avoid contact with anybody showing any possible symptoms of coronavirus. They should not be leaving their house, even to go and do essential shopping or to the chemist. They should absolutely not be attending any gatherings, even if it's in a private space. And again, like I said, they shouldn't be going out, doing shopping, travel. They shouldn't be traveling to work. And the support that's going to be put in for these people, and has already been put in, is that communities will be tasked with delivering food to them, delivering medication to them. So there will be support. And obviously, if somebody feels that they fit into this category, either they've been told and they're not feeling they're getting the support, then they really need to reach out to their GP, who will then be able to put them in contact with the right facilities. Or if you feel that actually you or somebody you know should be shielding, but they've not been told to shield, then again, make sure you reach out to your GP to get that further advice. And if you're living with somebody who is shielding because they are at high risk, then make sure you minimize. Again, it's a similar advice to whether you're living with a vulnerable person, but you want to minimize the time that you're spending in shared spaces. Try and keep that 2-meter distance. If you can, obviously use different bathrooms. If you're sharing, make sure it's cleaned after each use. If you're sharing a kitchen, again, avoid using it whilst the shielding person is there. And again, taking your own meals back to your own rooms, using a dishwasher, etc. So the advice is pretty much similar. It's all about that distance. We know that so the 2-meter rule comes from just through some research and through some anecdote, but it's about trying to spread that aerosol air spread of the virus. And then obviously the shared spaces, the shared kind of surfaces, etc. It's about reducing the spread through touch. Now, in terms of maintaining mental well-being, especially now, somebody's going to have to spend 12 weeks at home, so a very long time, and we're struggling with 1 week, 2 weeks, 3 weeks, but 12 weeks is significantly long. So try and do some exercise at home, and I've just included some slides, so some really good, if you search for NHS exercises, there's some really good exercises for people of all abilities to do in their own houses. And I'm more than happy to share the links. I'll share some pictures from that in the next slides. Try and spend time doing the things you enjoy. Try and eat healthily, well-balanced meals, lots of water, avoiding smoking and alcohol and drugs and all these kind of things. Try and get some fresh air into your room. These are easy to say, but try and sit with a nice view if possible and getting some natural sunlight. Obviously, for some people that's possible, for some it's not. But it's just trying to make the most of what you've got. And you are allowed to go outside. You can go outside into your private space, into your garden. But you, again, just remember that you need to stay 2 meters away from your neighbors and household members, if you're sitting on your doorstep or something. So we're not almost finished. We've just come to some simple exercises that I thought these were really good. And we could imagine, a lot of our sick people who are high risk individuals, they tend to have poor mobility. They probably don't think they could do much exercise anyway. But these are really good. So just sitting on a chair and just bringing your arms out, so straight up to your shoulders and even above your head if you can. This one here is about crossing your arms over and then twisting around. This here is just about lifting up your knees off the chair one at a time and then just doing these repetitive movements. And this one here is about actually just lifting your leg up straight and then just straightening and bending your ankle. So these are really, I'm pretty much sure a lot of people should be able to do this. Simple exercises. Again, these are about just moving your arms up and down, moving your head left to right, etc., and then just stretching out your neck. Simple exercises that I think we should promote into all of our vulnerable and high-risk individuals, and especially our elderly. So there's a lot of evidence that we know that somebody who is housebound or is not spending much time going out and walking, you quickly lose muscle mass. And by losing muscle mass, you then at higher risk of having other illnesses. For instance, you may find it difficult to balance yourself, and then there's a risk of falls. So we want to make sure people are staying active and doing some form of exercise. And as people feel more, as better, or they want something more challenging, they can do these strength exercises. So just simple, getting up and out of your chair and just repetitively doing that. So you might do it 2, 3, 4, up to 10 times, maybe once or twice a day, using the chair as a support and doing some sort of mini squats. Again, really good simple exercises. Again, depends on the ability and how well or unwell the person is, but they could definitely try and build up to these. And then finally, there's some exercises here, just try and strengthen those, the hips and the leg muscles, which are really important for balancing. Again, using the chair as support and trying to do these exercises. I wouldn't suggest rushing into them if people are not confident, but they can definitely try and stand with support and then try and just lift one leg slightly off the ground, just a centimetre, 2 centimetres, just to try and start getting that sense of standing on one leg, and then they can build up to these movements.